Good morning, Henry Paulson. I am Mihiraa. Let's start the warm-up sessions. Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, and a helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn from. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data, but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Your preparation time is over. You can now start the role play.
Good morning, Mihiraa. I'm Henry, one of the nurses here. Could you please tell me your name for verification?
My name is Mihiraa.
Mihiraa, please confirm the reason for your visit.
I am here for a pacemaker installation.
Thank you for the confirmation, Mihiraa. I understand you have a lot of questions about the procedure, and I want you to know that's completely normal. Before we go into the details, is there anything on your mind right now that you'd like to share?
Yes, I am. My heart has been giving me a lot of trouble lately with all the dizziness, and frankly, I am scared. I'm worried about what this little machine will do to me, and if I will ever feel normal again. My doctor said it's to help with my bradycardia, but I don't really know what that means. I am so confused and a little bit frightened.
It sounds like you're feeling quite overwhelmed, and I completely understand that. It's a big step, and it's natural to have those feelings. Mihiraa, my purpose today is to walk you through everything so you feel more comfortable and confident. Well, to start, a pacemaker is a small, battery-operated device that we place in your chest to help your heart keep a steady beat. Your doctor mentioned you have bradycardia, which means your heart is beating too slowly. A pacemaker is crucial for this because it ensures your heart pumps enough blood to your body, which is what helps to reduce those dizzy spells and fatigue you've been experiencing. Ultimately, its main purpose is to help you feel like yourself again and get back to your daily life. What are your thoughts on that?
That makes a lot of sense. So it just gives my heart a little nudge when it needs it? What about the procedure itself? Will it hurt? I found online that I will be awake during the procedure.
That's a great way to put it, Mihiraa, and those are excellent questions. The procedure is generally straightforward. We'll make a small surgical incision, usually just below your collarbone, and then gently guide the wires to your heart. You'll be given a local anesthetic, so the area will be numb, but you'll be awake throughout the procedure. Being awake allows us to communicate with you and make sure everything is going smoothly. Before we move on, do you have any allergies or have you ever had a negative reaction to any kind of anesthesia in the past?
Not that I know of. My biggest fear is that something will go wrong during the procedure itself. How long will it take?
That's a valid concern, but I can reassure you that pacemaker installations are very common and have a very high success rate. The procedure typically only takes 1 to 2 hours, and once it's over, you'll be moved to a recovery area for monitoring. After the procedure, it's normal to feel some mild discomfort or soreness at the incision site. For the first few weeks, we'll ask you to limit the movement of your arm on that side and avoid any heavy lifting or strenuous activity. This is to ensure everything heals properly and the device settles into place. How does that sound to you?
That sounds manageable. So, if I just rest and take it easy, it will heal on its own?
Yes, that's right. And following the post-operative instructions is critical for a smooth recovery. By following these instructions carefully, Mihiraa, you'll help prevent infection and support proper healing. This also significantly reduces the risk of complications, such as the pacemaker wires shifting out of place, which could delay your recovery. It's all about giving your body the best chance to heal. Do you have any other questions about the recovery process or anything else?
Just one last thing, I think. My granddaughter told me I can't be around microwaves or things like that. Is that true?
That's a very good question, Mihiraa. It's smart to ask about those things because there are a lot of myths out there about pacemakers. The good news is that most household appliances like microwaves are perfectly safe and will not affect your pacemaker. We do, however, advise that you avoid very strong magnetic fields. The most important one to be aware of is an MRI machine, as its powerful magnetic field can interfere with the device. When you get a new pacemaker, we will also give you a special card to carry with you that lets other medical professionals know you have one, so they can take the proper precautions. For everyday items like cell phones, we just recommend you hold the phone to the ear on the opposite side of your body from where the pacemaker is. This is a small adjustment that helps ensure the device functions correctly without any issues. Does that make sense? And do you have any other questions about these adjustments?
Oh, I see. That's a relief. I was really worried about the microwave. Thank you for explaining everything so clearly, Nurse Paulson. I understand now, and I'm okay with making those small changes.
That's perfect. So, Mihiraa, if you're ready, I'll record your consent and we'll begin.
Let's go ahead with the procedure.
Thank you for your consent, Mihiraa.